About different types of grief. We talk about the complicated grief. We talk about loss of siblings, spouses, loss of jobs. A situation we have to deal with now is loss of pets. A lot of people now grieve about the death of their pets. And the first thing we need to do when we're facing any type of counseling situation, especially grief, bereavement, loss, is to address the assessment. So here today we're going to talk about the assessment, why is it important, and what do we need to do to make sure we serve the best interests of our clients. So our learning outcomes for today is to be able to describe why assessing bereaved clients is important. We also want to identify what personal challenges can cause additional distress to the clients who are in the grieving process, and then address the referral services and how they can be used with clients who need help outside of counseling. So we're going to start with a small video. I want you to direct your attention to the screen here. All right. So here we go.
Imagine that you are a psychologist, and Maria comes to see you. Just looking at her, you can't tell what's wrong with her or why she has come to your office. What do? Well, you probably answered, I talked to her, of course. Talking to Maria is a good first step in figuring out what's wrong and how to treat her. A clinical interview is a dialogue between psychologist and patient that is designed to help the psychologist diagnose and plan treatment for the patient. It is often called a conversation with a purpose. What's the difference between you, as a psychologist, talking to Maria, and her best friend talking to her? There are several key differences in a normal conversation and a clinical interview. First of all, a clinical interview has a focused purpose to diagnose Maria. If she is just talking to her best friend, the conversation doesn't have a focus and could wander around to any topic. Second, in a clinical interview, the roles are clearly defined. You are the psychologist and Maria is the patient. As such, you might ask more questions and the interview is really only about Maria. In contrast, when Maria talks to her best friend, they probably both ask questions, and they might talk about her friend's troubles too. Finally, a clinical interview occurs within a defined time frame. When Maria talks to her best friend, they can start and end their conversation whenever they want. But with her psychologist, she knows that the appointment is for Tuesday from 2 to 3 in the afternoon. Let's look closer at the types of clinical interviews, as well as how to conduct a clinical interview and the benefits and limitations of them. Again, imagine that you are a psychologist. How might your clinical interview be different from Maria, a first-time patient, and Sarah, a long-term patient that you've had for years? How might it be different from Maria, who doesn't appear to have anything wrong with her, and Bridget, a patient who is forced to come see you because she keeps talking to trees and other inanimate objects? There are many types of clinical interviews that can be used at different times and with different people. Let's look at two of the most common clinical interviews, the intake interview and the mental status exam. The intake interview happens the first time someone comes to see you. This is the interview where you, as the psychologist, ask what brings them to you, what their mental and physical health history is, and what they would like to get out of their time with you. When you talk to Maria, for example, you might start by asking why she has come to see you. She says that even though everyone else sees her and thinks she's fine, she feels like a mess. She's stressed out all the time and has been experiencing panic attacks. You might then go on to ask questions about when the panic attack started and ask her to elaborate on her life and problems. Remember Bridget, the woman who talks to trees? Unlike Maria, Bridget appears to have something wrong with her from the get-go. Not only that, but when you begin to talk to her, you realize that she's not answering your questions in a logical way. She's making no sense whatsoever. A mental status exam is a clinical interview that looks at more than just the answers to your questions. You can look at a patient's behaviors, appearance, attitude, and movements, as well as their answers to your questions. All things will give you a good view of what their mental health is like. Of course, a mental status exam can be used on any patient, including those who seem lucid, like Maria. But it is often used on patients who are not able to talk clearly about their problems. Whether you're doing an intake interview, a mental status exam, or one of many other types of clinical interviews, there are several elements that are important. First of all, psychologists conducting clinical interviews need to offer a safe space for discussion. The client needs to be in a non-judgmental space in order to open up. In addition, reminding a patient that you will not share their information with others unless there's an immediate danger to the patient or someone else.
All right, we're gonna stop right there. Basically, you got a small gist of what the assessment process does. But what we need to know is can you go ahead and read that for me, Nehemiah? Go ahead, read those. The what?
The five bullets?
Yes.
Who, what, where, when, why.
So when we're doing assessments, that's basically what we're trying to find out. Like in the video, they were telling us that each individual is important and different. All right. So when we counseling our clients, we need to make sure that our assessment is thorough and detailed as much as possible, so that way we can go about helping the client out as much as possible. Okay. So what I want y'all to do right now, I want you to think about what type of clients or what the clients are going through that might need some counseling, some assistance. All right, Sabian? So I need y'all to go ahead and think about that. Write stuff down right now and then share it amongst each other. Then you're going to share it out loud, okay? Go ahead. So you're going to write down why somebody will go to bereavement counseling, grief counselor, what kind of things that they're going to be experiencing, okay? What are you thinking? Why would somebody need bereavement counseling?
So they can also allow their family or them.
That's great. And keep thinking along that side. And why are you thinking about that? Think about also what emotions might be occur. Hold on, just think about that, and we're going to discuss that as well. Think about the emotions that might occur that might cause you to need counseling assistance as well. And let's see if we come up with everything the same, or do we come up with some different things? And try to remember our conversation that we had last time about grief and the different parts of grief. We're going to reiterate that again because that's important into determining the assessment. So we got to link everything together. All right, and that's part of our knowledge content base. We want to be a competent counselor, so in order to do that, we have to link everything we know together. Okay? Raise your hand if you're done. All right, now share with each other real quick. Take your time, discuss things that you see amongst yourselves that are common, different, and share them with each other so we can see where everybody's at, okay? Go ahead.
Okay, so who's going first?
How much of that? Grief counseling because it really help with things they're going through. What kind of things? Like anger, depression.
What about you, please?
Mine is that they can know about things on their family.
Mine is like basically on both what you said and what you said. It's like a loss of someone, animals. The main thing is not get along with each other, such like two couples and stuff. They can go to a brief therapy or counselor.
Or if it's happening at work, they can go to their manager or their boss.
They can experience sadness, loss in money management.
You're good? All right, so basically when listening to you all talk in your group, y'all brought us some interesting things. Jasmine, go ahead and tell us about the emotions, okay? Let's start off there. Give me some emotions y'all discussed that can occur. Go ahead.
Anger, depression, sadness.
Okay. Nehemiah, you see anything else? You got anything to add to that?
Depressed, sadness, anger, if there's something good, happiness, or there can be
Okay. Grumpy or angry, yeah. We consider irritability something that maybe not the individual might not know they're irritable, but they might get words or hints from their spouses or from their co-workers that, hey, you on the edge, all right? And so they might come to counseling to figure out, why in the world people calling me on the edge, right? So they might not know what's going on. They just want to get some reassurance, okay? They want to verify and validate their feelings and emotions and learn how to control them. And some people just wanted to go to a counselor just to say, hey, everything's okay. And sometimes we need somebody else to tell us everything's okay. Because the next person may or may not understand what we're going through, right? And we will not know which direction to go unless we do the assessment, all right? And part of the assessment, as we learned from the video, is being able to identify the verbal and nonverbal responses. So when we consider the nonverbal and verbal responses, we might look at her face. So she might say she's sad, but if we don't listen to her talk and listen to her real carefully, she might be internally feeling angry. So not only sad on the face, but angry inside, as well as she might be smiling. Just because somebody, go ahead.
Just because somebody's smiling don't mean that they're really happy.
Just because somebody smiles doesn't mean they're really happy. Excellent, excellent point. So, do everybody cry?
No.
No. So, if we just saw on a piece of paper, right, somebody just said, hey, this is why I'm here. If we don't actually do a face-to-face assessment, then can we base everything we're about to do on that one piece of paper?
No, because the person that is talking to the waiter is not going to understand because the waiter didn't explain what was the problem or what happened.
All right, so that's perfect. So, as we discussed briefly, it's your ethical responsibility to know your client. What things you might need to know besides their emotions and other things? Can you give me something?
You are going to have to know about their age.
The age. The age can dictate how we discuss information with them. Age along with education and things like that. Will I talk to you the same way I would talk to Sagan? No, because you have different experience levels, you have different background. What other background information we might need to know is on the screen.
Okay.
Jasmine.
We're going to know what they're going through.
Okay, that C word. What's that C word?
Yes.
Culture. Culture. We have to know their culture, okay? Because some things that you can do with an American or the Eastern world, us, Western world,
It can be anybody.
you cannot necessarily do the same thing with somebody else from a different part of the world. So you might have people, we know America has a bunch of immigrants and people come over here all the time. You got to be prepared to work with those people. So part of your assessment is getting down and knowing, hey, what things can you talk about? What things you can't talk about? And also how to approach different people. All right? Some people believe in burial. Some people believe in cremation. And so you have to respect the beliefs of the other person while you are their counselor. All right? And that's being competent about their culture. Part of your assessment, you can do several different interventions and inventories. Let's start with inventories. All right, we're not going to go into too much detail about inventories, but inventories are used to basically help us get the foundation started. Okay? So your inventory might ask, how are you feeling today? How did you feel yesterday? Did you feel depressed? It's going to ask a lot about your feelings. It's going to ask about your family background. Did you have family there with you? No. Who's your support system? Do you have mental illnesses in your family? Do you have other medical conditions? In the video, they talked about the interview. So these inventories are usually written down, okay? And they're checklists. They're checklists for the client to go through. And as we look at our inventory, we go by and evaluate those inventories. We use those along with our verbal assessments, along with other interventions, to determine the layout and the floor plan for the treatment. All right? So when we think about interventions, there's several different types of interventions based on that inventory in which we can say, hey, maybe we should try this. Maybe we should try that. Interventions such as writing. Some people are great at writing, so you might want to start thinking about having your client be able to write down what happened. All right? You might also think about interventions such as spoken word. Okay? Some people who aren't comfortable with talking out loud may choose to be writing. With children, oftentimes we use play therapy as an intervention for grief. because a lot of the stories will unfold, a lot of the emotions will unfold while the child is drawing or writing, all right, or doing anything. Sometimes a child suffering with complicated grief will not talk, all right, and that's part of your assessment. You will learn that assessment with the parent. Okay, you bring in the parent, you bring in the child, and this is called what? Family therapy, family counseling. All right, so you bring the child in, and they don't talk. Why might they not talk?
They might be shy.
They might be shy.
Or they don't want to talk about what's going on.
They don't want to talk about what's going on. So can you treat that client the same as a client who's talking a lot? No. You're not going to get nowhere. All right? And one key thing after you finish your assessment, you start your treatment plan, and hopefully you caught that child does not talk through your assessment with the parents. And you might be able to understand what silence is for that child. Silence, certain moments might mean one thing or another. All right, and again, the assessment process can aid in you being able to direct yourself accordingly to the right plans. All right. Any questions?
No.
So I kind of jumped ahead of myself when we talked about different types of applications of assessment. One is knowing when to bring the other family members in. All right, the assessment will let you know that, hey, you might need somebody else in the room besides that person. All right, so you would think about family interventions or family counseling sessions. You might think about individual counseling based on your assessment, and then you might find out that your client might benefit being around other people who understands what he or she is going through. A lot of times with grief, we as clients do not believe that somebody else is feeling the same way we do. All right? And the worst thing you can do is fail to give a proper assessment and put somebody in a group session, and everybody in that group is talking about something that has nothing to do with what you're going through. How's it going to make you feel? Say, for instance, you lost a dog, and they're talking about loss of jobs. They're going to make you comfortable, or you're going to feel like your counselor is ineffective?
I feel like my counselor is
Ineffective. So, are you going to continue going to that group session?
No.
No. What are you going to do?
Yes, to a different one.
Go to a different one. And as you as a counselor, if your client goes to a different counselor, what does that mean?
That means you have to go to another.
What does that mean for you? What does that mean for you as the counselor if your client now is going to somebody else?
Time to work on yourself.
Time to work on yourself, and you lose out on
Lose out of money.
money. And you can also, if it keeps happening, because a lot of clients, they will do reviews. And you keep getting bad reviews, say for instance you working for somebody else, guess what happens? If you work for somebody else and they keep seeing that clients are giving bad reviews about you, guess what they're going to do to you?
They also gonna
Fire you. Go ahead. They're going to fire you. Jeopardizing, if you have a license, jeopardizing your licensure. Because you weren't competent enough to dig deep into that client's assessment, and sometimes you did not reassess your client and went about a treatment plan that is not appropriate for your client's needs. All right? So that happens more often than not, especially in places where we talk about PTSD. And PTSD can be related to grief, and oftentimes it is related to grief, loss of someone. But we fail to remember that PTSD does not happen only on the battlefield. So if somebody was previously diagnosed by another client, by another counselor with PTSD, and they called you up, say, I need help, right? Let's give a scenario, a good scenario. They just moved to the area. They called you up, said, I was going to my last counselor because I had PTSD. I was diagnosed with PTSD. And you say, okay, we have several group sessions that we can put you in, right? They throw you in a PTSD class. And that PTSD class is about war.
Yeah, you might got
You might not have been in war. Does that mean you don't suffer from PTSD? Everybody around you going to be talking about war, and how they were affected by war. PTSD from earthquakes, floods, things of that nature. May not be grief, but just give you an example. That's not grief, but give you an example. You say it is grief, depending on how you look at it. The loss of valuables, loss of dogs, loss of animals. Sometimes, as we know now, the loss of spouses, the loss of family members, loss of schoolmates, classmates. That's a different type of grief, but it's PTSD as well. So we send you to a group class that's about war. It's not going to help you, okay? Also, briefly touch on this as well. If we are evaluating our client and we don't know enough information, the best tool in our arsenal is to be able to refer the client to someone else or to provide additional services. All right. Previously we talked about the 5 stages of grief. I don't think we're going to go over that right now. Okay, we might touch on that a little bit. Who needs to know about the 5 stages of grief? Because we just talked about that, about sadness and stuff like that. Okay, well, let's just go through that real quick. Okay, denial, anger, bargaining, depression, and acceptance. Those are the 5 stages of grief. There's more, and part of your assessment is to know exactly which stage your client is going through. Okay, not everybody's going to go through denial. Not everybody's going to be angry. Not everybody's going to bargain or go through depression.
Of course, that.
Okay, and not everybody's going to be accepting. So let's go back 1. So part of the referral process, we might see a person that's going through a lot of anger, and we might be able to help them with communicating with others. But they might need a booster. So part of your assessment is to understand, do that client need anger management classes as well? Maybe that grief caused more heightened anger in that client. Or maybe, as we discussed, spousal loss. Maybe the parents are lost in trying to communicate with their child. So they might go through couples counseling just to talk about what's going on in their family dynamic. Then some people resort to drinking, all right? So there's AA programs. We can handle everything else. But we may not know how to get our clients to stop drinking, okay? Hold on one second. And then another part of our assessment is we may need to give our client assistance financially and referring them out to a financial counselor, XYZ. So all of these things are part of your assessment. And if you don't do it correctly, you lose out on your clients. Your clients might go elsewhere. Your clients might decide they don't need you. Other things can happen that's more detrimental. You incorrectly diagnose somebody and miss that they were suicidal. Tragedy can happen. Who is going to be at fault?
It's going to be the
Counselor. You do not want to be at fault of something happening to your client because you did not properly assess. All right. Anybody got any questions? And we kind of went over things again. But anybody got any questions? Jasmine.
how long does normal grief last?
That's a good question. In our next class, we're going to talk about that. Normal grief usually lasts about 3 months. But when you talk about complicated grief, Complicated grief can last for a lifetime for some clients. All right, so next class, we're going to talk about normal grief and what is not normal grief. All right, thank you.
Okay.